Hi, everyone. Thank you for coming. I do my research with Reese Goulier, and today I'll be talking about the use of young plasma in post-op patients. To give you guys a little bit of background, surgery triggers a profound immune response, as we all know, and this is mainly mediated by a profound innate response that's pro-inflammatory in the first day after surgery, and that gradually becomes an anti-inflammatory kind of resolving phase by post-op day 3. This process, however, is exacerbated in elderly patients, and it's thought to be due to a process known as inflammaging, which is the accumulation of inflammation as a person progresses in age. Now, there's been a lot of hype around young plasma, especially to counteract the effects of inflammaging, but all of this has been done in mice models. So we basically proposed looking at human studies instead, or looking at how they perform in human models. So the objective is to investigate the effects of young plasma on the immune system in surgical patients. GRF 6021 is a proprietary plasma fraction that was created by Alka-Hest and manufactured by Grifols. It has components of young plasma that have been known to counteract inflammation and other degenerative processes, again, mostly in mice. And it has been shown to be safe to administer in patients. The hypothesis is that young plasma can decrease post-operative inflammation in elderly patients. So we enrolled 36 patients who were undergoing hip and knee replacements. They were randomized to either receive GRF 6021 or a saline placebo. As you can see here, there were no major differences between the two populations in terms of age, sex, and other surgical and anesthetic considerations. This is a double-blind RCT. We gave plasma infusions at 4 separate time points: the day before surgery, 1 hour before surgery, 1 hour after surgery in the PACU, and on post-operative day 1. We then also collected whole blood prior to each of these plasma infusions. Our primary outcome was to look at the immune response to plasma fraction infusions, and we do this using mass cytometry. So what we do is we isolate all of the white blood cells, we tag them with heavy metal conjugated antibodies, and we run them through a mass spec machine. This gives us the ability to look at readouts of each of these antibodies for each individual cell. And what's interesting about this technology is it allows us to profile essentially the entire immune system. And then we can look at the activity levels inside each of these individual cells, such as MAPKAP2, CREB, STAT5, NF-kappa B, and STAT3. And we use this to build an immune profile for each individual patient. So using those phenotypic markers, we created a TISNE where you can see all the major immune cell subsets, and we can use this to look at the overall immune response to surgery. So for example, STAT3, phosphorylated STAT3 is low before surgery, but it increases after surgery and continues to increase on post-operative day 1. On the other hand, NF-kappa B doesn't necessarily show the same robust response. We can then now look at each of these time points and look at the differences between groups. So the arm that received the placebo versus the ones that received the infusion. As expected at baseline, there are no differences between the two groups. So the infusion itself doesn't trigger any sort of immune response. However, immediately after surgery, there is a difference between the arm that received the infusion, and that continues to be seen on post-operative day 1. Now, looking at each of the models in a little bit more detail, and immediately post-op model, we have AUC of 0.9, a p-value of 0.0001, and this is driven largely by activity in regulatory T cells. We continue to see this on post-operative day 1 with an AUC of 0.71, p-value of 0.025, and we see phosphorylated STAT3 activity is lower in CD8 naive T cells in the patients that received the infusion. We see this in regulatory T cells and to a lesser degree also in resident CD4 T cells. Now, if you look at how these activity levels are shown over the course of surgery, you can see that the patients who received the placebo or received the infusion actually had a decreased inflammation response to surgery compared to the ones that received the placebo. You see this in CD8 naive T cells, in regulatory T cells, CD4 naive T cells, but not in classical monocytes. Now, this is particularly interesting because our group has done research in the past looking at post-operative cognitive decline in post-operative patients. And we see that STAT3 in regulatory T cells is actually higher in the patients who do exhibit signs of cognitive decline. And we also see that in CD4 naive T cells, and actually as well as in classical monocytes, but it's much later in the postoperative period on post-op day 7, which our data set doesn't actually capture here. So we also looked at some clinical outcomes. This study isn't actually powered to look at any clinical outcomes, but there is an interesting trend towards significance. Patients who received the infusion had decreased fatigue and function and also less pain, and they had lower opioid consumptions during their hospital stay. So in conclusion, this is the first study to show that young plasma has immune modulating properties in humans. This also shows that the young plasma works mostly on the adaptive immune branch, but it preserves a lot of the innate mechanisms that are necessary for post-op healing, pathogen defense, and it has the potential to improve some post-operative outcome measures such as post-operative cognitive decline, pain, fatigue, and function. So with that, I would like to thank the Godelier Lab, as well as our collaborators, Dr. Shred, Dr. Ingst, and Dr. Agayapur, and I'll answer any questions.